We are all blessed here on this peninsula of Cape Cod that we have a wonderful acute care healthcare system that we've developed from its very early foundings at Cape Cod Hospital in 1918. One little building with 3 beds. They had to carry people up and down the stairs back then. It was built on the bay because most of the injuries came from the sea. Falmouth Hospital was founded over 40 years ago, and the community feels very strongly about that hospital simply because they actually literally built it brick by brick.
I can remember when the Cape Cod Hospital was a doctor's house. This was in the early 1920s. In one lifetime, it has grown from this 2 or 3 bedroom house into what we have today. It's incredible.
The quality of care that we provide in this Cape could be anything we can imagine because the community always will stand beside us and partner with us. So if we dream it, we can do it here because the community in partnership with us will make sure that that happens. And that's the beauty, I think, of being on the Cape.
Cape Cod Healthcare, when it was formed about 10 years ago with the merger of Cape Cod Hospital and Falmouth Hospital, has really transformed the healthcare delivery system on Cape Cod. These 2 hospitals used to be a place that were not an option for people when they had the option of going to a hospital for care. They were only an option for emergency care. And now these 2 hospitals, with all the awards they've won over the last 10 years, have become just terrific healthcare institutions.
There's no question now that it has a different perception, that it clearly has almost tertiary care status. I mean, you're not getting transfers per se, but there's a lot of stuff going on here, like bypass surgery that goes on in tertiary centers. So I think clearly it's been upgraded in terms of its capabilities, and it's done well with those upgrades.
I think that medical care is supposed to be homey. You're supposed to feel like the people who are caring for you are your neighbors. They care about you. They're not worried so much about you as a disease, but you as a person.
I think one of the differences about Cape Cod Healthcare is that because we are a small community, the patients we serve are each other. We serve each other's families and sisters and friends and neighbors and teachers, and so I think that just reinforces the commitment of all the members of our staff.
Everyone who works here is a neighbor. Everyone lives within 5 miles of each other. And once you realize that, you say, this is what I thought medicine was always supposed to be, the sense of community.
Oh, I've been very happy with Falmouth Hospital. We're exactly a mile away, so it's you could walk if you had to. It's not like a large city where you go in and you're just, a number. Here, you know the people and people know you, and it's just part of the community.
I'm probably not going to use a hospital in Boston if I need any health help. I'll probably want to look into being treated at my community hospital.
The value of the Cape a lot of times is the community. Obviously the environment, the physical beauty, but also some community pieces. This is a fascinating place to live. As a result, we can attract healthcare professionals here that you wouldn't expect to get in a comparably sized facility.
The doctors here are the ones who have gone through all the great training programs and now just want to take care of patients, and that's all they do. We've attracted very good specialists who like to practice and who are very good at it. The other part, probably has always been there, is the nursing care. But that's a key element because people get better with good nursing care. And I think nursing really has done very well. If you look at the PRES scanning results, if you look at all the results that we can gauge the quality of our nursing on, they're fabulous. And I think that's one of the reasons our outcome data is so good. because the patients are getting good care, they're getting personalized care, they're getting care that's for friends and family.
We've added a number of physicians, and every physician I've recruited since I've come here has been a residency-trained emergency physician. I think the community deserves that level of quality in the docs who take care of them in this emergency department.
I walked through the hospital on Saturday and a patient was being rushed to the cath lab, a patient with a heart attack. And that patient got phenomenal care. Our outcomes in our cath lab are among the top 5% in the country. Our outcomes in surgery, cardiac surgery, are better than many of the academic centers in Boston. Our joint replacements have better outcomes than many of the academic centers in Boston. People don't realize the excellent care that's here, and if they didn't have this great gem, they'd find out how difficult it is to make a trek to a faraway place for routine care. So this is a community asset, and the way we're going to make it great is to work together. The unions, the staff, the doctors, the board, the administration, and the community.
I had quite a bit of experience with the hospital, having the open heart surgery. I went there, they brought me there in critical condition, and I recall the doctor coming to my side of the bed in the emergency room and saying, "I'm going to stay with you until I get you stabilized." He said, "I won't leave." And he did. He got there, got me into stabilized and into shape, and it was just a perfect situation.
I had triple bypass about 10 weeks ago. It all went fine. I was out of there in 5 days.
The care was wonderful, and after the catheterization and before the bypass, we knew everything that was going to happen, and, you know, very attentive. It was extraordinary.
And I've had a few operations recently. I've been involved in a couple of situations in my own life 3 or 4 years ago where I was ill. And there was a decision between going to Boston or staying on Cape Cod, but the care I received at Cape Cod Hospital and the follow-up care has just been tremendous.
I've been very involved with the VNA and their services. My mother has in the last 5 years had multiple surgeries and hospitalizations here at Cape Cod Hospital, and the VNA has been instrumental in her care while she was at home. And we're there from occupational therapist through physical therapist, home health aides, nurses, being there when they were supposed to be there, guiding her through her home care was instrumental of keeping her at home.
The surgery turned out very successfully, and at the end of my experience, very honestly, I am not at all demeaning any of the Boston hospitals, which are by and large excellent. But I don't see how I could have gotten any better care at any hospital that I know of, and I know most of the major hospitals in the whole area. I don't see how I could have gotten better care anywhere than at Cape Cod Hospital.
Well, you know, over the last 10 years, Cape Cod Healthcare has raised over $125 million to the system. And we're here to launch a new $100 million campaign, which is really going to be vital to securing Cape Cod Healthcare's position as we go forwards. There's a tremendous need, whether it be in cancer care or the new Women's Breast Center or a radiology department. It goes on and on. There's a lot of needs to be met. And the administration does a good job of prioritizing those needs to make sure we get what we need when we need it.
I don't think we're asking the community to give us financial support if we're not managing well. We don't want them to give us aid to cover poor management. We'll do everything we can to manage by any reasonable parameter extremely well, but at the end of the day, I think that there's going to be some need for philanthropy to stay on the cutting edge of technology and facilities excellence.
Well, I've been associated with hospitals for several years, so I know that it also is a financial struggle all of the time, and therefore the community has to support it not only by using the hospital when necessary, but by providing financial support to the hospital, because every hospital needs charitable contributions from the members of the community that can afford to do that.
You have to support it. I mean, everybody at some time in their life is going to use the local healthcare system. And whether you support it as a patient or you support it as a donor and in a philanthropic way, either way, it's important to do that.
We were able to become members of the Lightkeeper Society, and we feel that's our way of giving back.
As a donor, I think that if people can, they should support what they have. You have a wonderful facility here, both in Falmouth and in Hyannis, and I think it's the thing to do.
There's a time for everyone in society, and the time is now for others to come forward and to show whether they are really committed to this community and want to be able to help everyone in the community through an organization that has to be ready to serve all of us at any time. The Campaign for Cape Cod Healthcare.
Campaign for Cape Cod Healthcare.
Campaign for Cape Cod Healthcare.
The Campaign for Cape Cod Healthcare.
Honoring tradition.
Honoring tradition.
Honoring tradition, inspiring change.
Inspiring change.
We are the future.
We are the future
of Cape Cod Healthcare.
Cape Cod Healthcare.